Pain stops too many people from loving their life, and in the case of degenerative disc disease, whether it's the medical indifference you're experiencing at a doctor's office, or if it's the constant feeling you have to navigate symptom management on your own, people start to lose hope. If this sounds like you, stay tuned, because in today's video we're going to be going over what in degenerative disc disease causes your pain, dizziness, and those sensations of anxiety, which it seems like no one wants to explain. We're also going to be going over long-term prognosis of the disease. And then finally, along the way, we're going to be going over 3 considerations that you should go over with your doctor to see if these aren't meaningful ways in which you can not only reduce your pain, but also improve your symptoms for a lifetime so that you can get back to making the most of your one life. But before we get started, if you know someone else struggling with degenerative disc disease, make sure to share this video with them, because this information will help both of you with your pain to symptom management. And with that, let's get started. When you first get diagnosed with degenerative disc disease, the first thing you're most likely to do is Google what that condition actually is. And a lot of people are surprised to find what it is the natural degeneration of the spinal column with age. But that degeneration isn't diagnosed as DDD until you start experiencing pain. For this reason, a lot of doctors are going to dismiss your condition and your pain symptoms because they just look at it as a natural part of getting older, but they don't consider what can compromise the nerves, which then start causing pain, dizziness, and even anxiety. And you're probably saying to yourself, well then what are those factors, Mr. Smarty Pants? First off, your doctors aren't wrong. Discs don't have a lot of innervation, so when they rupture, you don't feel a lot of pain, at least not from the disc. The disc can still put pressure on surrounding structures, which will cause irritation and nerve compression, which can lead to additional pain. But then what about chronic pain in which that disc is dehydrated and it's no longer putting pressure on surrounding tissue? Overstimulation of these nociceptors, or nerve pain cells, starts to overstimulate the central nervous system, and you end up developing a condition called allodynia, a process in which even small stimuli can cause pain. And that's why our first consideration brings us to reducing inflammation in our diet, and also considering why I didn't leave myself that much room on the whiteboard. But at any rate, whenever you are doing an anti-inflammatory diet, you want to reduce things that agitate your nerve symptoms, things like processed foods, sugars, trans fats, and saturated fats, all of which will increase nerve irritation. And when we're already facing central nerve irritation from allodynia and that neoinnervation, the last thing we need to do is keep adding chemicals which keep flaring it up. Additionally, what you're going to want to do is add things to your diet which will bring inflammation down. Things like grapeseed oil, fish oil, olive oil when you're cooking. Also healthy nuts, which are going to help provide more oils and healthy vitamins like your B complexes that your body can use to rebuild healthy nerves. Also consider minimizing irritants in your environment or things that you ingest on a regular basis, things like caffeine or nicotine from cigarettes, both of which tend to make inflammation and nerve irritation way worse. You can also talk about supplementation with your doctor, things like curcumin, GABA, or CBD, all of which will be useful in limiting the amount of inflammation around nerve cells, while also helping to produce proteins which decrease pain signals. And if you're interested, there is a link to the supplement company that I use down in the description of this video. And that's all great, because that does explain why you're feeling pain, even though this is just a normal degenerative change that most people, if not every person, goes through with aging. It explains why your pain is valid, and why, despite this being a common occurrence, you start to develop pain symptoms. But it doesn't explain why you get dizzy. And it also doesn't explain why you feel anxious the more intense your symptoms get. If you have degenerative disc disease in your neck, this most often occurs because of tightness in your upper trap and suboccipital muscles, and because of the densely innervated muscles at the base of your skull that communicate with the nerves in your ears and eyes for head motion. Let's say you tilt your head. Because you contract those muscles send a signal to your inner ear and your eyes to rotate appropriately. And so that all three systems communicate where your head needs to be to move the rest of your body and keep you safe. But let's toss you upside down on a roller coaster. Now you're not actively contracting those muscles at the base of your skull, but the nerves in your inner ear are giving your eyes and the muscles at the base of your skull signals that you are moving, whether volitional or otherwise. So you can see how these systems communicate, but now imagine if those muscles are so tight that they're sending wonky signals to your ears and eyes. Rather than those systems saying, okay, there's something wrong, let's just ignore these messages, they integrate those nerve impulses, and as a result, you experience dizziness because your eyes see one thing, your ears experience another thing, but your muscles are so tight that they are sending another signal completely different from your ears and eyes, leading to a neurological dissonance. Similarly, the muscles in your neck can get so tight that they actually start pinching down on your vagus nerve, also known as your parasympathetic nervous system. This is the nerve that exits at the base of your skull, posterior to your ears, and what it does is it down-regulates all the other systems in your body, meaning it slows your heart rate, it slows your breathing, and it slows your digestion. But if it's pinched and the rest of your body is no longer receiving those calm down signals, then it just goes off the hinges and you start experiencing panic attacks. This is personally why I like to talk to my patients about stability drills, and I think it's why it would be a great consideration for you to talk about with your doctor. Because a lot of the time, the reason that a muscle gets tight is because its antagonist muscle, the muscle that pulls it out of that position, is weak. And as your spine begins to degenerate from natural aging, the angle that those muscles pull at shifts, and that shifting can cause those muscles to fire incorrectly. And so, rather than just stretching a muscle that's really tight to protect your neck, we need to strengthen the muscles that will then allow those tight muscles to relax. Otherwise, all we're doing is opening you up to further injury, overriding your body's own defense mechanisms to reduce pain, which is great in the short term, but it never solves the underlying problem, which is weakness of your stability muscles. Now, I want to do two things to help you guys out with this one. One, you can watch this video all the way to the end, and I'm going to link to another video on YouTube that shows you several safe exercises you can perform on your neck today to help increase stability. The second thing is a free little gift down in the description. It is the first module for the cervical disc recovery blueprint, where I'll be explaining what happens when you have a herniated disc or bulge, and then also 3 exercises you can perform today at home to kickstart your steps in the right recovery direction. But then once you start moving in the right direction, with appropriate diet, appropriate supplementation, and exercises to help stabilize your neck, what are the long-term effects of degenerative disc disease? And what does that mean for you moving forward in terms of lasting results? And the answer is, it depends, because degenerative disc disease is a lifelong condition. It's not a disease in the sense that it's contagious and you contracted it, but it does suggest that you're wearing out your spine potentially faster than you should be. And the same as with brakes or tires on your car, a lot of the time these things degenerate because of how you use them, which is good and bad, because if you have abused your body from poor diet, poor nutrition, poor ergonomics at work, and I realize I'm saying that as I'm slouched forward like a bum, but then also not doing any activities to strengthen your neck, it's going to leave you vulnerable to injury. But if you make changes to decrease inflammation, improve posture at your workstation and when you sleep, and then also make it a habit to strengthen your neck on a daily basis, then there's nothing saying that you can't slow the progress of the condition, or in some cases, significantly reduce, if not eliminate, the pain, because your pain generators are actually coming from weakness and instability in your neck and not the damaged discs. But then what about guidance? What about actually having someone there who not only understands the joints in your spine, but someone who can actually help you long term, making sure you're doing the exercises appropriately, that your nutrition is where it needs to be, and that you're not doing anything that's going to further jeopardize or compromise your neck? This is when you would want to talk to your primary care about visiting a chiropractor. And not just any chiropractor, but a good chiropractor. Because if all they do is rush you in, crack your bones, and send you out, it's not quality care. But if you can find a chiropractor who will take the time to look over your spine, talk to you about your pain and your conditions, and not just adjust you, but also find the exercises to help stabilize your spine, especially the regions where your degenerating discs are most severe. It has helped so many people where physical therapy has failed, medical doctors, surgeons, and pain clinics have failed to finally start experiencing significant improvement in their symptoms. With that said, if you are in the Brackenridge area, feel free to stop in. I'd love to work with you, because for me, some of the most fun cases I get to work with are people who feel like there's nothing that can be done for them, and to show them that there's a lot that can be done in a short period of time to get them back to living their one life. And then after all that, where do we go from here? Don't forget that at the end of this video, I am linking another video on 3 exercises you can do to stabilize your neck today at home. Additionally, please do me a huge favor and share this video with someone you care about that might also be struggling with degenerative disc disease, because this information doesn't help anyone if nobody hears it. And with that, guys, thank you so much for watching. I'm Dr. Beck, and until next time, I hope this video and this channel help you to make the most of your one life.